While the pandemic continues to rage, funding that has been helping families is going to come to an end. The Families First Coronavirus Act is one of these programs. So what happens next? KX's Sunny Sai has more.
It looks like a nightmare.
Of the several programs that are expiring this year, Families First Coronavirus Act ends on December 31st.
It required employers to provide paid sick leave was one of the major pieces of it. And it was, I believe, 2 weeks at full pay and then up to 12 weeks at 2/3 pay. And this was one piece along with some other benefits passed around at the same time.
Professor Bullock says nearly 90 million people may be affected by this act alone, and without more support could lead to an increase in COVID-19 cases.
If you have to support a family and you get a cough, and you know that if you're sick and you have the coronavirus, you're not going to get paid and you can't go to work. Well, what is everyone's incentive in that situation to do is to provide for their family. Not only are we talking about lost ability for people to take time off to take care of their children, and lots of school children are being sent home, but we're also talking about making the pandemic worse by making people choose between whether to work sick so they can provide for their families or stay home and maybe not be able to feed them.
As holiday season continues, Professor Bullock says the pandemic is far from over, and that puts more of a financial strain on families.
We haven't even seen the worst of the pandemic yet. So if it made sense to help protect people when it wasn't as bad as it's about to be, I don't see any kind of rational, logical arguments for not extending some significant unemployment insurance benefits and some significant paid leave benefits.
He is optimistic the government will be able to find a temporary solution before the vaccine is released. In College Station, Sunny Sai, KAGS News.
Bullock says without the aid of these programs, more people may become homeless as they choose between health and living wage.